Hello, everyone. So welcome to another teaching video from Large Academy. And today the case is headache from subarachnoid hemorrhage. And the scenario here, you have Dr. Steve Orio, who's behind a desk, clipboard in hand, and across from him is Joy Andrews, a 65-year-old woman who describes a sudden sharp pain in the back of her head. She mentions that the pain lasted for a few minutes and was accompanied by a sensation of warmth and nausea. Her neck feels stiff. Dr. Steve listens to her and suggests that these symptoms is consistent with a particular diagnosis, and he recommends CT scan or MRI to confirm that diagnosis. So you have to take a history from this patient. Like we have always done in our previous videos, we like to give you something to help you. And here the memory aid is Prep H, ICE, Real Dance Party Series with friendly selective discussions with examiners. Now, with that said, let's jump into Prep H. So Prep H means the P there is to prepare. And so within the 1 minute reading time, you try to recall the memory aid we've just given in this video. And for this particular history of headache, which is a form of pain, Socrates would apply. Because of that, I'll just remind us of what Socrates is. So S is site, O is onset, C is character, R is radiation, A is association, T is time, and then E is exacerbation / relieving factor, and S is severity. Now, I would start engaging with the patient very soon, but before you do that, in a typical exam, you would have to enter the room and confirm your candidate number and name with the examiner. Now, after that, I would go on to introduce myself, identify that I have the correct patient, obtain consent to take history, seek permission if I intend to take any notes during the consultation, and then that would be the setting. So now I am ready to engage with my patient, and in the clinic here, I sit with Joy Andrews. Is a lit room. So we start in the role now. Good afternoon. I am Dr. Steve Orio. I'm one of the candidates tasked with taking history from you. Before I proceed, is now a good time to talk?
Yes.
All right. Thank you for confirming. Please, could you confirm your name and age, please?
Yes. Hello, I'm Joy Andrews. I'm 65 years old.
Thank you, Joyce Andrews. It's nice to meet you, Joyce. Joy, today I've been asked to ask you a few questions regarding your condition. Can I just ask again if that's okay?
Yes.
Oh, sorry. It appears that the light is causing you some discomfort. So we would switch off, we would draw the blinds and switch off the lights. So we reduce the amount of extra light. We just work with the sunlight, if that's okay. Do you mind if I give you some analgesia?
Yes, thank you.
Okay, so yes, would ask the nurse to bring you some analgesia. All right, thank you. Now, so sorry to see you like this. How can I help you today?
It's just the headache and the light.
Oh, sorry. I hope with the blinds down and the lights dimmed, it would help. So sorry to hear this, Joy.
Thank you.
Okay, we need to make sure you're comfortable. Okay, just let me know when you are comfortable to proceed.
Yes.
Okay, so the first thing I'd like to ask is, let's try to understand this pain better, Joy. Where exactly do you feel this pain? Could you point to the site for me?
Yes, it's mainly in the front and on the side sometimes.
Okay, okay. When did you first notice this pain? Did it start suddenly or gradually?
About 2 days ago, it came on very suddenly.
Okay, thank you for confirming that. Could you please describe the nature of the pain for me? Would you say this pain feels like, something is being squeezed like this, or something is being pressed down, or something is being stabbed?
It feels like a constant throbbing with some occasional sharp stabs.
Okay, thank you for describing. Sorry to hear that. Does the pain move somewhere else from where you've described?
It feels like it's just there. It's not moving anywhere.
Okay, I'd like to ask now, do you know of anything that worsens this pain?
Yes, bright lights and loud noises.
Oh, sorry there. Sorry, yeah, I did notice that. So let me just find out. Since it started, did it come and go, or has it been constant? Is there a specific time during the day when this pain is just terrible?
It's been constant since it started, but sometimes it feels more intense. I think it's worse in the morning, but then it lingers throughout the day.
Oh, sorry to hear that. Is there anything you found that provides relief or makes this pain stop, even for a little while?
Lying down in the dark helps a little bit.
Okay. Now, if you had to rate this pain on a scale of 0 to 10, 0 being no pain, 10 being the worst pain you've ever had, and you can imagine, where would you put this pain?
Oh, goodness, it's an 8, sometimes a 9 in the mornings.
Oh dear, sorry to hear this. Now, I have understood your general pain profile. I'd like to just ask a bit more questions now. Joy, so I'd like to explore a little bit about, what you've presented with. Have you had recent incidents where you banged your head, or you had a fall and you had a hit to your head?
No, I haven't had any recent falls or injuries.
Okay. I noticed that you're quite sensitive to light earlier. Has this always been the case? Can you hear me?
Yes.
I noticed that you've been sensitive to light earlier. Has this been consistent?
Well, yes, bright lights have been particularly bothersome to me lately.
So it's been a recent occurrence, I suppose.
Yes.
Okay. Do you feel any stiffness in your neck?
A little, now that you mention it. I thought it was just tension.
Okay, okay. Have you noticed a rash anywhere in your body?
No, no rashes.
Have you been feeling generally unwell or had a fever recently?
Well, I did feel under the weather a few days ago, but no fever.
Okay. Have you experienced seizures, jerky movement, or blacked out unexpectedly?
I've never had a seizure or blacked out, no.
Have there been moments where you lost consciousness?
Oh, no, not at all.
Any weakness in your arms or legs?
Well, my legs feel heavy, but I thought that was just age.
How about your vision? Any disturbances or changes you've noticed?
Well, sometimes things get a bit blurry, but it's not very frequent.
So any changes in sensation, perhaps numbness or tingling?
Oh no, none of that.
Have you experienced any vomiting recently?
Well, once a couple days ago.
Oh, sorry to hear about that. And your appetite?
I haven't been eating as much, I'm just not feeling hungry.
If lastly, have you noticed any unintentional weight loss? If so, can you estimate how many possible pounds or kilograms you think you might have lost over what period?
I've lost about 2 kilos in the last month without trying.
Okay. Thank you for answering these questions, Joy. These are very useful in helping us to understand what's wrong with you and giving you the appropriate care. I'm going to ask you a few more questions now, if that's okay. Now, let's start
Yes.
with a few things. Do you experience any chest pain, shortness of breath, or cough?
No, not really.
Any muscle or joint pain?
Occasionally, my joints ache, especially in the morning.
Do you take any medication? If so, what's the dose?
Just the usual blood pressure medication once a day.
Okay, and have you been regular on this medication?
I'm sorry?
So have you been regular on taking the blood pressure medication?
Yes.
Okay. Are you allergic to any drugs or medication that you're aware of?
No, not that I'm aware of.
Okay, can I ask if you have any other medical condition that you see your family doctor for or anything else?
I have mild hypertension. I had an appendix surgery when I was younger, but that's it.
Okay. Can I just ask you a few personal questions?
Yes.
What's your occupation?
I'm a retired school teacher.
Okay, who lives with you?
My husband and our dog Charlie.
Okay. Do you have any difficulty with stairs or mobility in general?
The stairs can be a bit challenging sometimes.
Do you smoke? If so, how many packs a day?
I used to, but I quit 10 years ago.
How about alcohol? Do you drink and how many units per week?
I occasionally enjoy a glass of wine, maybe 2 or 3 drinks weekly.
Okay, thank you for confirming that. Does anyone in the family have a similar problem or notable health issues?
My mother had migraines, but I'm not sure if they were like this.
Okay, so now I would just summarize a few things for you. Can I confirm that you have history of hypertension, you're on medication for it, you're a retired school teacher living with your husband, you used to smoke, but quit a decade ago, and you drink alcohol minimally, and you had migraines as well. But in addition to that, you've complained about this nagging headaches that you've had for, you said just recently, you've had this headaches that is worse with movement, worsened by light, and you feel a bit of, you also have some neck pain, but you do not have any rash.
Yes, that's correct.
Okay. So does this sound accurate?
Yes.
Okay. So I'd like to understand your opinion a little bit. What do you think is causing your symptoms? And what are the main concerns about this? And what are you hoping that we can do for you?
Well, I thought it might be due to stress, but now I'm worried it could be severe. I hope to find some relief and answers to what's causing this.
Okay, thank you, Joy. Is there anything else you would like to add before we proceed?
No, that's all for now.
Okay, thank you for sharing all this information. It will significantly help us in addressing your problems. I would like to discuss with the consultant now. And so I would just say if you can wait for me for a few minutes. While you are waiting, the nurses can give you water or a few drinks if you like. If you give me a few minutes, I'll come back and discuss further with you, if that's fine.
Yes, thank you, doctor.
All right. So here we discuss with the consultant. I'll present the case to the examiner now. So patient is Joy Andrews, a 65-year-old retired teacher who presented with severe headache and photophobia. She's on antihypertensive for mild hypertension and had underwent an appendectomy in her youth. Socially, she's been a non-smoker for a decade, drinks about 2 to 3 glasses of wine weekly, and experiences challenges with stairs. Her mother has migraines, and Joy attributed her symptoms to stress, but now harbors concern about its severity and origin. She seeks both relief and clarity about her symptoms. So the examiner would ask, what is your differential diagnosis? My foremost differential diagnosis is subarachnoid hemorrhage. However, given the presentation, I would like to evaluate the patient for meningitis because of the symptoms of meningitis may overline. Meningitis, however, will present with fever, neck stiffness, and photophobia, and a purpuric rash as well in bacterial causes. Another important differential is encephalitis. I would look for signs of altered consciousness or seizures along with headaches. Migraine, while typically a clinical diagnosis, is present, could be altered from a history of recurrent episodes with associated photophobia, phonophobia, or aura. Also, cases of elevated intracranial pressure, a brain tumor could present this way, and whereby the patient, I would look for gradual onset of symptoms, focal neurological deficit, or changes in mental status. I would also consider giant cell arteritis, elderly patients with temporal headaches, jaw claudication, and visual disturbances would raise suspicion. My management approach would be to stabilize this patient using the ABC of resuscitation, airway, breathing, and circulation protocol, as well as ensuring the GCS status, Observe in the interim, oxygen, I'll ensure I order a complete blood count, electrolytes, inflammatory markers, and swiftly arrange for a non-contrast CT scan. Investigations, I would do a CT brain. This is non-invasive imaging, rapidly assesses brain tumors and other structures. I'll consider where appropriate a lumbar puncture and do a CSF tapping and do an MCS and CSF analysis. Then, depending on the outcome for subarachnoid hemorrhage, CSF tapping can be confirmatory as well. However, it has to be done with caution. I'll consider referral to a specialized neurosurgical unit. Meanwhile, I'll offer supportive care, enforce bed rest, and start on aggressive hydration with 3 liters of IV fluid over 24 hours. In terms of medication, I'll administer nimodipine, 60 milligram orally every 4 hours to starve up the cerebral spasms and concurrently provide laxatives to manage the nimodipine-induced constipation. Interventions that can be considered include endovascular coiling if there's an aneurysm, surgical evacuation, And depending on the bleed and location, one can do a craniotomy. I'll host a team discussion with an MDT, with a comprehensive neurosurgical MDT. This would be my management, and then examiner will say thank you, and this ends the scenario.